Good morning, Pat Ziemer. Well, no sound. Where's tapping to our sound? For some reason, we have no sound. No sound. Whoop, do we have sound now? Do we have sound? Sound now? Testing. One minute. Test 1, 2. Test 1, 2. Can you hear me? No sound. No. Test 1, 2. You have sound. I can't hear sound. All right. Can you hear me okay? Give me a thumbs up if you can hear me okay. For some reason, I'm not seeing sound on my camera, on my dashboard here. Can you hear me? Give me a thumbs up if you can hear me. Idle Hour can hear me. Thank you. But I'm not seeing my sound at all, so I feel like I don't have sound. So my question is, test 1, 2. Test 1, 2, 3, 4. Test 1, 2. Test 1, 2, 3, 4. Well, now I appear to have some sound now. Testing 1, 2, 3, 4. Okay, we have sound. Don't know what my technical difficulty was there, but we do have some sound now. So, and I really can't tell till I log in and hit the go button because I don't see anything on my meter until after the intro. So, good. I'm glad we're here, and I'm sorry for the confusion there as we got started, but it gave us some time for some folks to come along and join us. Pat Ziemer here from MagnaWave, Tuesday morning office hours, where I come together with you to answer any questions that you may have with regard to MagnaWave, PEMF, anything that's on your mind that you would like to talk about. So I'm here to answer your questions. If you have a question, just put it in the chat box and I'll pull it up and take a look at it and answer it. If you would be so kind, potentially share this with your friends, so if they have questions, they can come on and join us and have their questions potentially answered as well. So let's get right after it. I'm asked a lot of times, how, do you feel like you give the same answers or answer the same questions? And, in reality, I do get asked the same thing over and over and over a lot of times. And those of you who are regulars on this Tuesday morning office hours probably hear the same answers in some cases over and over. But it's occurred to me that I really don't know who might be on that's hearing it for the first time, or all of a sudden somebody's on and I answer it again and then it clicks to them as to how it applies to what they're doing or how it answers a question that they may have about PEMF. So with that regard, I don't want to be redundant a lot of times, but when someone asks a question, that means that they want to know that answer that time, that day, in that type of particular situation. So I apologize if sometimes it seems to be redundant in some cases, but I never know when people want to have their questions answered, and when it's right time for them to hear the answer that they're potentially looking for. So with that, let me get started here this morning and go over some things that I've been asked recently. And the first one is really not a question. It was a question. It was presented to me as a question by a veterinarian. And I'm not going to mention any names or call anything out because that's not what it's about. But I thought it was a very interesting question, and it kind of approaches where a lot of people come today from health and wellness and Western and Eastern medicines and the whole nine yards. The question is, my question was if you were aware of any scientific research papers about the therapy you are selling. Just a statement that it works is not doing it for me. I'm a scientist and a board-certified veterinary specialist, and which I appreciate. I mean, a lot of study, a lot of time, a lot of experience behind that type of statement, and from the aspect of being a scientist. I find that a bit interesting, and so what I did is I responded with the studies that we have funded, although they were out of the country in Cuba that we've been part of funding particular studies and the results from those studies, and they've been published. But I'll come to that in a moment. And then I sent links to the Association of PMF Professionals, where all the studies, or most of the studies that have been conducted over the years around the world, are there for people to see and look at and understand. I shared with this veterinarian the number of devices that are approved by the FDA in the United States for various indications, and so forth. And so the response that I got back from this veterinarian was, thanks for the links, but I have to say I prefer papers in peer-reviewed Western medical journals for believing the effect of a new treatment modality. I'll wait for FDA approval before buying into it. Which is interesting because I provided the different devices that are approved by the FDA in the United States for use in various situations. And as most of you know, that's non-union bone fractures, that now for brain tumors with glioblastoma, for autism and depression with the TMS machine, for incontinence in women, for muscle stimulation in people. So just several areas of FDA approval. But apparently it's not the FDA approval that this particular person was looking for, which I find kind of interesting. It also alludes to me to the fact, and I'm not, again, I'm just thinking out of the box here. And if you have some thoughts or comments, you can give me a call. Let me put my phone number up because I'd be more than happy to discuss this particular question with someone. But to me, my way of thinking is, okay, I prefer as much documentation as possible also. But if I don't step out of the box and look and see what's happening around the world, or step out of the box and try things, how is anything going to get advanced to the FDA for specific indications or specific uses? And a scientist explores, a scientist checks things, a scientist validates things, and that's what they're doing with the science. If I'm going to wait for another scientist to do it, and then I'm waiting for something that may be very beneficial to what I do. And so I look at it from a perspective of, people ask a question, but they really don't want to explore the potentiality of the answer. And I find that kind of interesting. I would love to know what you think. If you want to give me a shout and visit with that, please do. Give me a call or make a comment in the box. Tell us where you're from, so forth. But I just found that very interesting a response when I gave, and I'll post these links. I will put these same links into this chat area after the program is completed, for you to go look at where these studies were performed, what studies have been done around the world, and the whole 9 yards. I just find it very interesting. But that's one of the challenges that we have when we talk about the therapy, and we talk about what it can do and how it can be used, and and people say, well, okay, is it FDA approved? Yes, the modality is certainly FDA approved. Is our device FDA approved? We're working on it. I also sent him the last 3 studies that we're completing with our machines that are now safety cleared and safety inspected to be submitted to the FDA. So I just thought that was interesting, and whatever you think about that particular response, let me know. And I just found it very interesting. Okay, people are talking about, another question, people are talking about being able to separately control the intensity and the frequency of delivery. What is MagnaWave's position on this issue? Well, I find that very intriguing also, but I'll explain what it is. There are devices on the marketplace that are where you can control the speed, which is the frequency of delivery, the speed of delivery, and the intensity. So in other words, you could have it clicking very fast, and you can turn up the intensity to where it's hitting pretty hard. Or you can slow it down to where it's clicking very slow, and you can turn it down to where it's hitting you very softly. And all that makes perfect sense. And is that beneficial? I mean, it will work. Here's what where we get lost, I think, sometimes. There's 2 reasons for our position. But I kind of lost my train of thought there. But let me come back to the first one. Our position is, and it's for the FDA and for being approved for various things. If you have a machine with 10 different settings on each dial, the intensity and the frequency. So if you run it at 1 and 10, and you have this device approved by the FDA, you have to justify and explain what 1 and 10 does. If you set it 2 and 10, 3 and 10, 4 and 10, you have to do all that for each one of those settings. So you go up 1 and 1 and 1, 1 and 2, 1 and 3, 1 and 4, 1 and 5, all the way up, and then 2 and 1, 2 and 2, 2 and 3. And what that means is you potentially have thousands, or at least multiple hundreds of potential settings that when you go to the FDA, you have to validate each one of those. Which means, in theory, you would have to have studies, what this veterinarian was talking about. Well, tell me where that study is. Tell me what it does. Our position, the manufacturer that we use, the position is if you want to go to the FDA and you need to justify these 10, if you will, if there's 10 or 15 settings, is easier to validate, easier to bring the health respects to the table for people to discuss than it is hundreds. Now, the hundreds may work just fine, but to narrow it down, and that's where it gets into, and there's a whole nother story there, but that's the position that our manufacturer takes, that for FDA validation, that's why you'll see devices for glioblastoma that are magnetic devices. They're caps they wear on the head, and they've got a machine that they use, and they've got X amount of settings. That's what they did it on, was the X amount of settings. If they had 1,000 settings, they'd still be seeking FDA approval. Does that mean that it's going to be improved over the years and they find that a different frequency may be beneficial, and then they can go into those devices and change them, or they can update them and get even a better result? Of course. But so in one sense, people are saying, well, this is good, we can do all this kind of stuff, but to document that and to show that it is that much better is very difficult, and there is no documentation that shows that doing that makes a tremendous difference across the board for all these different indications. The other thing that happens is people, when they use these devices, if they have all those controls, they don't know where to go. And then you have a manual that tells you where to go. Well, then if that manual, and this is where companies that are doing this are talking about this, and I'm not knocking the companies because they're working very hard, I'm sure, for their beliefs. But for them to say, okay, well, you put it on 2 and 4 and you'll get this, that's a protocol, that's practicing medicine, you run into situations that, so companies just back off and say, well, this is what it does, isn't that wonderful? And the way we're trying to approach it is, this is what it does, and here is what it does as we complete these studies and as we use these different intensities that we have available. So that's one of the reasons that we talk about the differences of intensity and frequency, and that is how we approach it. That brings us, and here's a prime example. I had a person ask me yesterday, well, I've read where the hertz between 30 and 50 is where all the optimum health comes from. And I sat back and I looked at this person in the office, and I said, well, you know, there's other studies that show that it's 10 hertz. Other studies show that it's 100 hertz. And other studies show that it is 50 to 60 hertz. And the real bottom line, if you go back and look at all the studies that have been done over the years, is that a lot of different things work. The therapy works. Have people found that a particular study shows that this hertz works, or this frequency works, or this works on their study with the parameters that they put in place? But then somebody else did a study and had a little different parameter, a little different question, used a different hertz or a different frequency, and they got favorable results as well. They all work. The question comes down to the speed of working. The question, and that's another question that we get into that this person asked me yesterday, but we get into that whole realm of what's the best. And I pointed out to this person that Dr. Bob Dennis, who did the NASA study, he did 10 hertz is the power source that he selected for his study. And so when he's asked, well, that's an arbitrary pick. He just picked that number because I got to pick a number, and that's what I'm going to use. And other people have done the same thing. And he said at our MagnaCon when he was speaking at MagnaCon, whereas the secret is the energy being delivered. It's not always the hertz. Now, that's not to say, and this is one of the things that we really like about our new digital devices, as research is done, and people who step out, scientists who step out to do research and to try to figure out where these differences are, if someone figures that this intensity at this speed of delivery will really kill this particular type of dangerous cell, well, the beautiful thing we can do is go in and program our machines to do that. So someone who owns a digital machine and they want to use it for that purpose could have it programmed to do a specific thing at a specific setting. And so we could make that adaptation and make that change. That's what's really cool about the digital side of the house and where it's going to go in the future. But when you look again across the board, it's really not important when you sit down, and it's important, but it's just something that's just so broad that how do you narrow it down to underline or cross the T or dot the I on that particular type of situation. So if that brings any questions up to you, or if you'd like me to try to explain that more succinctly, I will be happy to do that. Just let me know that that's a question that you may have. And just to kind of finish that up, so when this person said 30 and 50, I said, well, you can think that. And if you do think that, case in point, I had a doctor call me who has a device last week and said, well, she's got a client coming in and they're going to be treated for this or that, and they got a paper that says 1.5 hertz or 10.5 hertz is the optimum thing for what they're dealing with. Does our machine fall into that category? And our machines are powered between 50 and 60 hertz. And I said, well, we have had great results with treating what this person is talking about. People have been very happy with what happens to their wellness when they use our devices for that type of relief. But technically, can I say that we do what she's asking for? No. And I said, so that person, she said she's leery to be treated unless, or for having me to work on her, unless it fits that category. And I said, well, same thing. There's countless studies that show various things. It just happens to be the one that this person is looking at or reading. And so the important thing is to put it on and do it and see how it works. And if it works for you, because everybody is different, then you're winning the game, and it's working out very well from that perspective. And I get that question all the time, or questions like that. I do. Let's see here. We've got a question here. Let me bring it up. Okay. Dr. Jerry Dreesen, DC, CCSP, has stated that treating herniated disc can be detrimental. But how do we know if they have a herniated disc? Well, Dana, that's a very good question. And Dr. Dreesen and I have talked about that. What can be, and in any situation, what you run up against is you don't necessarily know if someone has a herniated disc or have they been to the doctor and had something analyzed. The issue is if you go too much energy into an area or treat too high, can you exacerbate the situation? And you can do that in many different areas when comfort is the key, and over non-comfort is not the key. And so when Doctor and I have discussed this, and that's the situation that you run into, it's not that you want to just make sure that the person is comfortable that you're at. And so typically, if someone has a herniated disc, you're not going to be able to use much intensity at all. And you don't want to use intensity to where it's biting at someone if they're trying to get better oxygenation and better health and wellness for their body. So it's not a I would not, and from that perspective, over the years, people who have dealt with their back pain or what they have going on, as a rule, they typically treat at a very moderate setting. They treat for 8 to 10 minutes, and they feel relief. And it goes that way. But you have to be careful in every situation as to make sure that the comfort is there. If a person doesn't know, I mean, I would think that I would just have to sit back and think that if someone's having severe back problems, they've gone to a doctor somewhere along the line and have a definition of what is going on. Now, from personal experience, my wife has 3 herniated discs in her upper back, and our protocol when we got started with this, and that's exactly how we got into this business, was because she got tremendous relief on her herniated discs with the treatment, and we treated moderately. We went on, and the routine was turn it up till it's how does she feel? Well, that's plenty. Okay, back it off a little bit. If you approach it in that position of erring on the side of caution and comfort, then typically our response has been wonderful. And so that is the statement, and that is the situation. And Dr. Teresa and I have talked about that. Just be subtle in what you're doing as you're approaching someone and see how it goes. My wife today, when she treats her herniated discs, and it's interesting, she goes to the doctor, they do an x-ray, they look at her, and they say, oh, we got to do something about your back. I mean, that's got to be horrible. She says, no, I don't have any back pain. I'm fine. Well, how do you do that? Well, I treat myself. Well, what do you use? Well, I use our PEMF devices. And she, when she treats her back now, she treats it pretty aggressively. But she's got her condition, what would be under control for her, and every person is different. So that's how I would approach it, Dana. I would approach each person different. I would approach them subtly, because you can take someone and make it very comfortable, do it 8 to 10 minute session, and they feel better. They feel better range of motion. You don't want to knock them out of the seat when you're doing that, but that's the thing to keep in mind. Great question. Thanks for asking. If we need more clarification, then ask again or give me a call and we can talk about it. 502-599-9722 is the number to call if you'd like to visit or talk about something this morning. Great question, Dana. Okay, let's see. And then yesterday I was telling you the questions that I received. The same person was saying, well, the only value I see in the higher power or intensity is for injury. Low power is said by many to promote faster healing. What are your thoughts? What are my thoughts? And, you know, people in the study, and what Dr. Dennis talks about is that he found when he did a study that at some point the lower power devices enhance the healing process a little. Now, that's good. And so, but when I spoke to this gentleman yesterday and was answering his question, he said, well, the only reason I see to the high powers to promote is with injury. Well, most situations that we're dealing with are a result of injury. Somebody has a problem, they're in pain, they want to be out of pain, they want to heal. Well, and this is where the high power comes into the situation. The higher power relieves inflammation and relieves pain more rapidly than a low power device. And people are looking for relief. And whether it's from an injury or stress working in the yard or playing golf, whatever it may be, if we can get after the inflammation and you can take the inflammation away and then you treat regularly, you don't have to bounce yourself off the chair every time you treat yourself. Once you reach the plateau that you're with, you can make it very comfortable, very low signal that's going in there, and maintain your comfort, maintain the position that you're in, and potentially allow it, as it goes along to heal, to be beneficial to the patient. So, you know, you look at that, but again, when someone says that, I say, fine, put them on a low power device. Like some of the competitors that are out there with low power equipment that they say is best and low is better, and see how long it takes. Sure, the low power devices have had people that have indications and they use them once or twice and they have great relief. But as a rule, when you look at them and they tell you treatment times and how long it takes, it just takes longer. Well, if you have that patience and you have that way of looking at it, by all means, that's a good way to approach it. But if you want the response more rapidly that you're looking for, the higher power devices will give you that more rapid entry into the healing process. The more rapidly or the sooner we get at an indication, the quicker the result, the quicker the reversal with those types of indications that you may be dealing with. So again, just great question that he had, and we had a great conversation around it in dealing with his particular question. All right, let's see here. Let me take this down and put this question up from Dana. Do we have an estimate of when recordings from MagnaCon will be available? Well, great question, Dana, and we are trying to finalize them now. We have several of them that are complete. We have one or two that we have to do some additional work on. One of the things that we learned, we recorded this year's the entire event, and there were some audio issues in the room that we were in that had played havoc a little bit with our recordings. So the editing down of the recordings has been a pretty arduous thing to go through, but we're almost completed. So I would say that they will be ready for release certainly next week. May very well be. We're meeting after this broadcast. We meeting with my video crew and the marketing people with us to go over that, see where we are, what tweaking we need to do. We have one presentation that we may need to redo with the presenter so we have it perfect the way everybody wants it, and that could be added. We initially thought, well, let's just start rolling them out, putting them on a page and let people start getting into it and do it. But then we thought, no, let's just, kind of like they do on Netflix, let's just put the whole group out at one time so everybody's got it, so they can go through it. So that's where we are, Dana. We're right there ready to put that out. And it may very well, when they come this morning, they sent me a question yesterday, we may have it completed for the most part today and be able to put them into the platform and roll it out. So we're right on the cusp of doing that. Thanks for asking the question, and thanks for wanting to. We wish you'd have been there with us, and but you can pick up the content that was available, and it was excellent. MDs, chiropractors, veterinarians, massage therapists, just the whole thing. Practitioners. It was a wonderful event, and we're looking forward to rolling out. We're narrowing down the location for next year's event at this point. We visited some places yesterday, and we're trying to narrow down. One of the things one of the challenges we've had is we break up into the hands-on training is the veterinary, the horse veterinary part, or the large animal veterinary part has had to be outside. And this year it was incredibly hot. Not that that was a problem, because I think we have recordings of that, but people enjoyed it. But it was very hot, and it wasn't as comfortable as it could be. And so we've got a venue that is an excellent venue. It's a step-up venue over where we were the last couple of years, which we've been very happy with. But they have a facility and a manner in which we can bring the horse into the building, have it situated so it'll work well to do that, so that we can have a much more intense horse situation. We had some restrictions on what we could do with small animals at the venue we've been using, and that's been relieved in a different venue, so we can actually have multiple animals to treat and work with. And so anyway, that's kind of where we are with it. It also has more breakout opportunities as far as separating the various groups. So that's when the recordings will be out. That's what we're looking forward to for next year for MagnaCon, and to continue to bring the finest in education and learning for our practitioners in a hands-on type of environment that they may desire to have. So Dana, thanks again for the question. Any other questions, folks, just put them up there, and I'd be happy to take a look at them at this point. If you want to give me a call, please do that. I like calls. I like to talk to people because we can really kind of get into various things, but that goes back to a previous time in my life when I did some talk radio, and it was just a lot of fun. Let's see here. Then we had a question, what about promoting appetite? Have a horse that is recovering from ulcers and trying to get his appetite back. Well, and the responses were full body treatment, and they've had horses that have been in that same type of situation, and their appetite has been helped. Well, and you just think about that for a minute. If you get the ulcer in control, you still have it just, when you have the flu, you start to feel better and you get better, and all of a sudden you start to get your appetite back. So most certainly, if we can make the animal or the person feel better, And that's what therapy does. A lot of times it just increases the value of well-being and how they feel about themselves. And if you have good, healthy cells, good oxygenated cells, you've heard me say this a million times, but good oxygenated cells, good blood flow can work a lot of miracles. And just feeling better, getting over the situation, the appetite should naturally increase. But can we bring them into that state of well-being more rapidly? Potentially. And so I would think that was a great question that was asked, and the responses were certainly there, promoting full body treatment to improve the sense of well-being. Treat the pole, which just kind of clears up everything and lets them concentrate better on what they're doing, and same thing for a person. So. Great. These are some things that have been presented to me over the last few days, and that I like to bring to the table and discuss with you. If you have any questions, just put them up there and let me know. I don't want to take a lot of your time. I know you're busy, and there's a lot going on, and I just don't want to ramble on just to be talking, because I need to stay talking. I don't want to do that. So. Please, if you got a question, if you got a word, put a word up there that you'd like to. Let me just make sure there's not something else on here that I should have picked up. Nope, looks like that's about it at this point as far as questions that have been asked. Got several viewers. Our viewer count, interestingly enough, is going up. So if you want to type a word in the thing that you'd like for me to discuss, just do that. It doesn't have to be a question. But one of the things I said at MagnaCon, what really became very interesting, as we switched from speaker to speaker, I would go to the stage and open up the stage, or Dr. Nye would join me, or Dr. Dreesen, or Dr. Marty Goldstein would be there, and we'd just field some questions from the audience. And I made the statement, frankly, we could almost have a MagnaCon of discussion, kind of like the Johnny Carson show or one of these various programs where you can go on there and I got a phone call coming in. I need to tell them I'll call them right back. But where you can go on and just talk. And I think the reactions that we got from people were incredible. And the questions that they asked were incredible. Some of them were very basic. People wanting to know things about the machine and how to clean this or how to do that. But those are things that people want to talk about and ask. But we really got into some interesting questions about the health and wellness, about the studies, about what people are doing. And the one thing I'll just tell you, the presentation by Dr. Amanda Myers and Verlinda Thompson was outstanding when Verlinda's horse was badly injured in the field and broken bone and disintegrated or just decimated, and everybody was going to put the horse down, and they stood the course of time and used MagnaWave, and they documented the whole thing. And Western Horseman is going to potentially publish this story, but we've got it on video, and you'll just love it. It's an incredible presentation and incredible testament to what do I get. Let's see, Karen. Let's see, question here. Kathy asks, how do I get the Practitioner portal password? Well, Kathy, it would have been emailed to you, and if you're talking about the Practitioner portal on the website, I believe it's MagnaWave with a capital M. MagnaWave with a capital M, one word, should take you into the Practitioner portal on the website. If that's not correct, if I'm saying it wrong, call the office, and they'd be happy to give you that portal password to get in. If you're talking about the certification portal where you take the education and the tests, you should have received that password in the email, and if you don't have it or if it's not working, again, give the office a call, talk to Erin, and she will be more than happy to get you set up and back into the portal as you want to be. The office number is 502-742-7868. Let me see if I can put that up here. Well, I don't know where it's at. It's not there. Okay, 502-742-7868. If you have questions, and that goes for any. If you've got something that you want to ask or something that you need help with, where are these materials, that type of thing, just feel free to call the office. If you have a question for me, call the office. If I'm not in the middle of something, I'd be more than happy to discuss any situation that you want to discuss, to help you with your business, to help you understanding what the device will do, to help you with any of these types of questions. We're here to do that, and we want to do that as openly as possible and to answer your various questions. Okay, Kathy, thank you for responding, and we've had a good time. So again, if there's no other questions, thank you for watching. I'm excited when I see the number of people that are with us that, you know, they may have questions, but as I pointed out, maybe I've answered them already for them, or we try to cover it pretty well. So I want to thank you for joining me. I look forward to being back here next week with you. Got a vacation coming up in a couple of weeks, but that's okay. Thanks for being here. Wave on. Have a great day, and help bring health and wellness to a lot of people and animals, and we're grateful for that. Talk to you later. Bye-bye.